we do want to put faith in the fact that we should be talking about bilateral mastectomy, even if you only have one little mass in one gland, right? We should be, if the owner is going to go for surgery, we should be talking about bilateral mastectomy, and it's certainly okay to do it in a staged fashion, right?
Sorry for Saying Sorry Media presents the PUR Podcast, the best podcast for feline medicine and surgery with tips, tricks, and updates for the entire veterinary professional healthcare team. If you are dying to know more about cats, keep on listening. Here are your hosts, Dr. Susan Little, famous cat vet and author of multiple textbooks, and Dr. Yola Kerpenstein, talented surgeon and social media geek.
Hello again, this is Dr. Yola Kerpenstein, and this is podcast number 7. And I am going so to forget what the number is, so that's why we have Dr. Susan here. Hello,
well,
Susan.
I'm not going to remember either, but it doesn't matter. We're having, we don't remember because we're having so much fun. So how are you tonight, Yola?
I know, it's crazy. So once again, this is podcast number 7. These are the podcasts that we're going to dive deep into some articles and discuss what the article is bringing us. But before we do that, Susan, can you tell me anything that happened last week that is really cool?
Something that happened last week that was really cool?
Yeah, for you. So what are you doing right now?
Oh, yeah. Well, so what's really cool is that I actually get a vacation. That's cool.
Woohoo!
Yep, I am on vacation.
And that's amazing because you have definitely superseded me in the amount of travel that you do. I always was a crazy guy that was traveling everywhere, but now, how many flights did you already do?
Oh gosh, it's in the 90s, isn't it? Around 90, 91. Yeah. This is not a good thing. This is not something anybody should be trying to do.
No, we talked about that last year.
Yeah.
I remember that.
Yeah, I know. It's not a good thing.
I know. So, but you must like it in some way because otherwise you wouldn't do it. But I can imagine it's nice to be home and just relax a little bit.
And it's nice to be on vacation. I'm in a beautiful part of Canada. I'm in Nova Scotia, and I know that you are home in Kansas, and it's hopefully nice weather where you are too, right?
It is very sunny, as a matter of fact, so it's looking good, and everything looks kind of green-brown. It has been very, very dry. I think in a lot of areas in the world it's dry. It's that global warming that's playing around here, but my yard doesn't look as good as normal, but I'm trying to preserve some water because everything is very, very dry. And
well, it's very green here, so... Sunny and green.
It must rain a lot.
Oh, I guess enough. It rains enough. Yeah. Yeah, but we're inside. We're out of the sun. We're out of the rain because we have something cool to talk about, right?
Yes, we have. So this is the second article that we're going to discuss, and this time I will present it. And just because of you, I chose a surgery article.
Yeah, but can I say just one thing before you start?
What?
This article will win the prize of all the articles we've talked about so far for the largest number of authors.
I know, not only the largest number of authors, but also the largest number of cats involved.
Yeah, that's a good thing.
So the article that we're going to talk about is published in JAVMA, the Journal of the American Veterinary Medical Association, volume 252. June 1, 2018. We really want to make this actual. So this is what's happening. And the whole reason that Susan and I do this is there's one reason, and that's we both feel that there is not enough literature about cats and cat medicine.
Yeah.
And the reason, so I was very optimistic, and I dove into the latest JAVMA journal, which was, I think, July or August or something like that. And I was looking, I was like, okay, cat article, and there was nothing. The only thing that was there, we talked about horses and dogs and dogs and dogs and dogs and dogs and dogs. And the only thing there was a response to the article that we're going to discuss now. And I was all excited. So I was flipping through the pages to that card article, and there was a really small little section that said, "We are very sorry, but we misspelled the name of one of the authors."
Oh, no.
That was it.
Well, but, you should apologize for that.
You should. But I mean, it's also really easy because there's like 100 authors on there almost now. There's at least 15.
It's a very international paper. And one of the authors, I will point out to you, did you notice? One of the authors on this paper is actually from Ottawa, Ontario, where I practice.
Oh, really? Who?
Yeah. Dr. Litvak.
Oh, Julius, yeah, he's fantastic. He's such an amazing surgeon, yeah. So I can imagine that he would with
Boston.
Anything. Yes, Sarah's on there. And Amit is on there. He's also working in Canada, so there's quite a lot of them. So. Yeah. And there are some Europeans on there. So this is really a multi-institutional collaboration. The title of the article is Association of Surgical Approach with Complication Rate, Progression-Free Survival Time, and Disease-Specific Survival Time in cats with mammary adenocarcinoma. And they have 107 cases, and those cases are collected from the 1990s until 2014. So, what a work. That is a lot.
So it's a retrospective. It's a retrospective case series, right? And they're all client-owned animals.
It is. 107 of them. So that's amazing. And, we do a lot of retrospective article reviews because there are a lot of retrospective articles, which probably is the lowest on the totem pole for scientific evidence. We always have to point that out. I always wave with my little pyramid and say, hey, this is a pyramid on the top. You have randomized critical meta-analysis, and then on the bottom you have case reports. And retrospective analysis are it's like a big case report, really, if you think about it. But getting 107 cases wonderfully done by this group. I think Dr. Mayhew is the big proponent of this article. We're very, very happy that it was published. So we applaud them 100%.
Yeah.
And knowing the fact that 80% of mammary tumors in cats are malignant, this is a good article to read because it tells you some really, really important facts. So, what they did,
and that's really important. It's really important to remember, though. I think I just want to draw a line under what you just said before you talk about the article. That in dogs, you certainly have a good chance that a mammary mass is benign, but in cats, it's malignant until proven otherwise.
Yeah, 50-50 in dogs, I always say.
There you go.
Yeah, so 80%. As a matter of fact, I always tell owners 90%. So I stand corrected here by this article. But it is a lot of the cats that that deal with malignant disease. So you don't have a lot of chances, and you better do it right the first time. That's what it's all about. So they looked at medical records, and really what they wanted to know is if a unilateral approach, so a unilateral mastectomy, taking one whole side, or a bilateral mastectomy, taking both sides at the same time, if there was a difference in survival time and disease-free interval. And then they had a couple of cases that had a staged bilateral, which means that you first take one side, you wait a couple of weeks, and then you take the other side. And they looked at all these cats. It's retrospective, and we'll go through some of the conclusions and relevance. But it is clear that we have a big winner of those three methods that you should use. Yeah. The one thing I have to say, and that's always the problem with these studies, is, and I'm a big statistics buff. I love statistics. So one, they did wonderful statistics in this article. What they could and should have done, they did. So 100% very, very positive, the approach that they used. But the problem with these cases is there's so many variables in it. It really makes statistics and statistical relevance, limited. So we need to talk about that. And one of the big no-nos is really there's a time limitation. So most of the cats that got unilateral mastectomy were early cases, and the bilateral ones are later cases. So we have this skewing of the data because of that. So if we probably cannot compare completely both groups, but there is quite a big significant difference in survival times between these groups. Just to make the big announcement, if you have a cat with mammary carcinoma, you better do bilateral mastectomy.
So even if there's just one little lump in one gland, I'm still doing bilateral mastectomy.
Yes. After you diagnose it's a carcinoma, which in 80% it is, we advise to do bilateral mastectomies because the chance that it either will recur or that it will grow in another gland is too high. Very rarely it's only one little spot. You can't see them, but they're there. So we really advise to do a bilateral mastectomy. And so as a matter of fact, three things that they were interested in, and that's called the zero hypothesis. So they want to show you some things. One is if there's a difference between bilateral and unilateral. We just talked about that. Then they wanted to look. They estimated that the complications for both techniques would be the same. And the third thing is that if you give chemo to these cats, that they would do better. And why do they do that? Because there is some discussion about chemotherapy. Most of the studies said it will help, but there's one study where they had a control group, which is better than just a retrospective. And that shows that chemo didn't do anything. So that was a little worrisome. And so they really wanted to look at it. And then they had zillions of factors that they looked at. And that is immediately the weakness of the study, because the more factors you have, the more difficult it is to prove anything, and you need a lot of cases. So I calculated already like 6 or 7, 8, 9, 10 factors that they looked at, which really makes the power of this study not so high. But we're having said that.
But we should look at the big picture, right?
Exactly. So and then hopefully we can answer that question if we should do a bilateral mastectomy. And then I can give you some of my personal feelings too about it. So if we look at the results, I'm just going to summarize it, is that complications occurred in about 20% of the cats with unilateral mastectomy, and about 35 to 40% in bilateral, either by the staged one or you do everything in one time. So that's a big difference, and that was also significantly different. So if you do only one side, you get less complications than if you do both sides, which is kind of logical because, it's much more difficult to close those cats after you take both chains. And then what we also found was that the median progression-free survival time, this is also called the disease-free interval. So that means from the time that you do the surgery until the time that the disease comes back, either, locally or distant, but as soon as you know that the disease comes back. And that was for bilateral mastectomy, 542 days, and for unilateral mastectomy, approximately half of that time, 288 days. So that was a big, big difference. So the cats that got bilateral had a much better prognosis. Let's look at the details of those numbers, because that is really important, I think. So there's as a matter of fact, two major things that we normally look at in these case studies. One is the disease-free interval that we just talked about, and then the survival time. And the survival time is really how long the cat survives after the surgery. And you can use some very difficult statistic tests where cats that survive, that die from other causes are kind of censored. So that's what they did. So they did a really good job in looking at that. The other thing that I felt was really, really interesting of this study is that most of these cases have progressive disease. So 60% of the cats will have progressive disease, either by local recurrence or by metastasis. And we know that this disease is really bad. And if you look at the local recurrence between unilateral and bilateral, the local recurrence was around 50% in unilateral, so that's really high, compared to about 20% in bilateral. So there's a big difference there. And then the metastasis, it was around 55% in the unilaterals and about 35% in the bilaterals, which also means that, you know, even if you take out both glands, there's still a pretty high chance of metastasis in these cats. But if you leave one gland, the reason that we don't like to do that in cats is that you extend the time of tumors that are in the other gland to metastasize. So that is the main reason that we've always said to do bilateral mastectomies.
And we know that the size of the tumor matters too. I know it's not part of this paper, but some other papers have looked at the size of the tumor at the time of surgery. And I think the take-home lesson there is that even when these tumors are really small, they may already have started to metastasize. They don't have to be dead to do that.
Yeah, that's right. Yeah. So there's a couple of factors that play a role in when you look, because what they did is a multivariate analysis when they put all the factors together and then look at which are the factors that really make a difference. And there was the type of mastectomy that we talked about, tumor ulceration, if it was present or not, if there were lymph node metastasis at the time of surgery, and tumor location. And tumor location was interesting for me because that's the first time I've heard that. And so if you have a tumor in the fourth gland, so in the last gland, close to the
caudal gland,
exactly, they have a higher risk, and that risk was about twice as high as if you don't have, you know, if the tumor is in one of the other glands. And the biggest
there's probably
risk
some anatomy reasons, right? There's probably something about the anatomy there.
Yeah, probably, but they don't really know. I mean, that's the thing.
No.
I would, you know, for me, it would be a lot more logical if it was the number one because those are more difficult to remove. But, you know, no, it's number four. So from the surgeon's perspective, it's not really logical. There was not really a big difference between the staged one, so where you do one side, wait 6 weeks, and do another side, which I thought was also an interesting fact.
And they seem to like that. I gather that they felt that it may be worthwhile thinking about doing it in a staged fashion, right? They said performing a bilateral mastectomy in a staged fashion might decrease your complication rate.
Yeah, that's exactly it. So if you know, I like when I have reviewed a lot of articles, and you know, you have done that too. So I always look at the tables and the pictures. And if you look at table 2, you see the difference between unilateral mastectomy. And this table is not the easiest table to read, but there is a double chance of infection of dehiscence with a single session bilateral mastectomy compared to either unilateral or staged bilateral. So I think that was really cool. And what they did is they added, you know, complications of one and the other side in the staged bilateral mastectomy. So I thought that was pretty cool how they did that. Yeah. So once again, well done. And then the figure in figure 2 and figure 1 on page 1399, there you can really see the strength of the difference of the two. With big p-values, but this is the Kaplan-Meier. You know, I did a lot of research, and you know, we were always hoping that the Kaplan-Meier would look like this. And this is when they veer away from each other. That's when they're significant, and you can see the significance really, really well between bilateral and unilateral mastectomy. So if we look at survival time, so we just talked about disease-free period before. If you look at survival time, then it was, I think, 375 days for all cats. But then if you look at the cats that had a bilateral mastectomy, the survival time was over 1,000 days, so 1,140 days, compared to 473 days with a unilateral mastectomy. We do have to realize that these data are, if you look at when it was done, most of the cats that were done were really early, so in the 90s with the unilateral mastectomy. So we have some time bias right there, and that is.
And I think that speaks to, you and I both have been veterinarians a long time, and I think that speaks to our evolving thoughts about how to deal with these patients, because around the time that I graduated in the late 1980s, we were still talking about whether we should do lumpectomy on those cats. And, right? And we moved from lumpectomy to single chain mastectomy, right? And then we moved from single chain to exactly this scenario. Do you do single or you do double? So I think you're exactly right. That bias is inherent in this study because of that time frame. Those earlier cats were done at a time when it probably just wasn't as common to do bilateral mastectomy.
Yeah, and it's I didn't need that timestamp, Susan, by the way, because I feel really young still, but it is true. It is true.
But it's true, right?
Yes.
You see the change, yeah. Sorry, the other reason I think that's important is, so then you've had this experience too, I'm sure. So you're talking to an owner, right? We've just found, I have a case I talk about in lectures, actually, a kitty named Jasper, where we found a small mass, very small, just on an annual checkup. And that owner's coming in for annual checkup, vaccinations, etc. And they're leaving with a cancer diagnosis. And not only is it a cancer diagnosis, but I'm talking about really quite extensive surgery. So there is, I think, an inherent reluctance to tackle these bigger surgeries in cats when it looks like they've got a small mass. And we exactly need this type of data to reinforce for us how important it is to talk to the owner about doing the bigger surgery, even if it's a stage bilateral, and not being tempted to do a much more limited surgery on these cats.
Yeah, you're completely right there. So as a surgical oncologist, that one of the first things I said to my clients that came to me, and you have to realize they went to the primary vet first and then they were referred to me, is cancer is bad in cats. So however, even if it's a very small one, at least we have a chance there, but you have to do a major surgery, and mammary carcinoma is the ideal example of that. There can be multiple little, less than pea-sized masses in the mammary chain. The mammary chain needs to go. I mean, there's no, and interestingly enough, remind me of that, but because I just want to talk about the multivariate analysis that they did for the survival time. Then we saw that the type of mastectomy, once again, was a very important factor. Lymph node metastasis, which, is logical because that means it's one stage further already. And then the treatment of chemotherapy and the development of metastasis, either local or distant. And here comes the chemotherapy system. So
this was interesting to me.
Yeah, so although it had no effect, it was not a significant factor in the disease-free interval, it is in the survival time. And when that comes out in an article, you always have to be a little skeptical because that doesn't make a lot of sense. So we use chemo to decrease, the incidence of metastasis or recurrence, and there it had no effect. But it might have slowed it down. So that might be one of the reasons. If you would ask me if your cat would I would put him on chemo. If it doesn't hurt, it definitely may help. So that would be my advice at the moment. But there is not really, really strong evidence for the. It
isn't clear, and it's also not clear what is the best drug or the best drug protocol either. So it's a bit murky.
Yeah, that's exactly it. And last but not least, so going back to the original discussion about what we were talking about just previously, if I am a reviewer once again, and I read these articles often with my reviewer glasses on,
Yes.
I thought the discussion was, I loved the article, but the discussion was, too long for me. And especially because they're now putting a link into, in a way which was interesting, but it was not really supported by the data that they got, to cancer, memory cancer in people.
Yeah,
although it was
quite a bit there.
I know, it was very, very
it's hard
interesting.
to link it up, though.
Yeah, so there was no relationship. So, I mean, it's interesting to do it. So if I would be an editor or a reviewer, I probably would have kicked out most of that stuff because it didn't really relate to what they were looking at. So it didn't relate to the hypothesis. And that makes these articles often really difficult to read, although the information was very, very interesting and also correct. The one thing I fell over at the end was then was this sentence, and maybe I'm getting a little bit too strict here, but it said, when it was talking about chemotherapy again, it was said, and because there are similarities between aggressive breast cancer in women and mammary adenocarcinoma in cats, results of the present studies support the use of adjuvant chemotherapy in cats with mammary adenocarcinoma.
Seems a bit strong, doesn't it? It seems a bit of a reach.
It does. So what I want to point out with this is be critical when you read these articles. It was a wonderful article, I think, on most things. Probably the discussion was not the strongest, but you cannot say that this is based on nothing. I mean, this is not supported by the study at all. And so you have to be very, very careful here. And that's something I think that probably the editor should have picked up on, and probably should have taken out for me. But, so that's my personal opinion. So the last thing I want to say is that there was no significant difference between surgical margins. Did you see that?
Ah, good point.
Yeah.
Oh.
So that's the last thing that we want to talk about. So really between clean, bigger than 2 millimeters, narrow, smaller than 2 millimeters, incomplete, there was no really difference.
Why?
Because the numbers are too small, most likely. So, there's really, really
it's
small
underpowered.
numbers. I bet. So that must be it.
And
then the definition of margins is interesting. So they use very, very small margins. So normally we look at 5 millimeters.
Yeah.
And then less than 5 and, whatever. But,
so we don't want to put a lot of faith in that, right?
So,
but we do want to put faith in the fact that we should be talking about bilateral mastectomy, even if you only have one little mass in one gland, right? We should be, if the owner is going to go for surgery, we should be talking about bilateral mastectomy, and it's certainly okay to do it in a staged fashion, right?
And that's exactly it. So I think that's good. And then I think more research needs to be done about the staged one, because I think probably the complication rate will be a little less. Probably also will be less painful for the cat, because they don't talk about the discomfort of the cat at all. Which, we are very, very strong about fear-free, treat the animal right. You don't want to have an animal that is miserable for the next 2 weeks.
And it's a painful surgery. It's a significant soft tissue trauma, this surgery, and pain control is paramount. So for me, that's another reason why a staged surgery makes sense.
And that's exactly it. So we are aligned again. Okay, so let's do the last topic. So we're running over a little bit, but this is so cool, is hot cat news.
And now, hot cat news.
So, Susan, did you find anything?
I do. I have some hot cat news.
Ooh, exciting.
I have lots of hot cat news, but I'm going to hold on to some of them for like the future. So what I do want to mention in this podcast, because it kind of fits with the surgery topic that we just talked about, and that is that this year, 2018, the American Association of Feline Practitioners published their feline anesthesia guidelines. So they are amazing. They are available for free. You don't have to be a member of AAFP to access them. So our website is catvets, catvets.com. We have a guidelines section, and the anesthesia guidelines are available there for free. And they were done by amazing people like Dr. Sheila Robertson, Dr. Peter Pascoe, who was one of my professors when I was in school, Dr. Heidi Shafford, and a number of other really brilliant people. So they're feline specific. They're done by great people. They're practical. So please have a look at them at catvets.com.
That is pretty
How's
awesome.
that for you?
That is pretty awesome. And I love it. I didn't read them completely, but I started with them, and they're really awesome. So,
and the one thing is a brochure for clients. That's one of the new things that we've been doing with guidelines is, obviously the guidelines are produced for the veterinarians and the vet nurses, but this set of guidelines, like many other recent ones, also have a brochure for talking to clients. And the last thing I loved about these guidelines is it includes a number of FAQs on troubleshooting things like how do you deal with bradycardia? How do you deal with hypotension? How do you deal with prolonged recoveries? So practical.
Yeah, that's wonderful. That is great tip. All right, so I have one too. And
you do? What's yours?
It comes from Purdue University news. So this was posted on July 18, 2018.
Okay.
And it is about a Bengal cat, and I love Bengal cats. They're so beautiful. But tell me, Susan, are they also practical?
Bengal cats? Bengal cats are gorgeous. Yeah.
But I heard they have very strong personalities. Okay, answer the question.
They do.
No, yeah.
What was the question? I forget the question.
So what is typical about a Bengal cat? What kind of owner should buy a Bengal cat?
Somebody who really loves cats because they are active, they're gorgeous, they're intelligent. No?
Yeah, that's me. So I should buy one. Excellent. Good answer, Susan.
I will add it to my I'll add it to my gift list for Yola.
I love it. So at the Veterinary Teaching Hospital and Purdue University College of Veterinary Medicine, they put in a total hip in a Bengal cat.
No.
So yeah, they did. So they were talking about the. Sorry.
Has it not been done before? It's not been done before.
I think they did before, but they said that most people do what we call an FHO or a femoral head excision or osteotomy, where you just whack off the head. And they said that they did it in people, and when they started people, as a matter of fact, the technique came from the dog, which I thought was really cool. And then they said, if we do it in dogs, and as a matter of fact, in dogs, they start doing it in smaller and smaller and smaller dogs, why not in cats? So this is Fritchie, a 2-year-old Bengal cat that, and you see a very cute picture of Fritchie in the aquatic treadmill. And that also gives, once again, it debunks a myth that cats don't like water, because this cat loves water. So. And there's a little cool YouTube video.
Who will go in treadmills. Yeah.
Yeah. So as a matter of fact, I can't remember which university I was at, but they showed me the pool, and there was a cat swimming in the pool. It was the rehab pool, and it was really cold. So the cat had these they put these safety harnesses on there, and the cat was motoring around. So that was really cool. So good for Purdue for doing this and writing about it to the public. So we are so out of time. Thank you, Susan, for a wonderful podcast again. This is so cool.
Thank you. We talk too much, We do.
We do. All right. Thank you very much, and see you next time.
Okay. Until the next time. Bye.
Bye-bye.
Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat Clinical Medicine and Management and August's Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs. You can follow her on social media with the handle @CatVetSusan. Dr. Yola Kerpenstein is a diplomat of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Yola works currently for Hill's Pet Nutrition. You can follow him on social media with the handle @GVetSX.